Hi, I'm WaltFritz. I'm the director of the Foundations and Myofascial Release Seminars, and I'm here at OakWorks today to do a few videos. The first one I want to show you is one of the first techniques that I teach in my seminars, and it's also a technique that I use every day in my clinic. I treat a lot of low back pain, pelvic pain, abdominal pain, and the first place I always look is deep in the front of the spine, lower abdomen. So what I have the students do, the therapists do, is when they come in, we're going to come in with a very soft hand here. I'm going to be directing first my pressure gently down toward the treatment table. And I'm going to continue to compress until I feel a very subtle barrier. The barrier is the place that I feel something stopping me, the tissue sort of pushing back. Once I hit that point, I then change directions. I keep the downward pressure, but I head up toward his head. And I continue to engage until I feel that second barrier. And that's the place that I want to wait. I'm not trying to force anything. And what I'm doing at this point is really just feeling and looking around inside of his abdomen and really into the front of his lumbar spine. A lot of the main musculature of the lumbar spine sits in the front, the anterior lumbar spine. The psoas plays a huge role in terms of back pain, as well as we're feeling into scar tissue here. So once I've got that barrier, that's where I want to just try and soften, relax, and just see what I see what I feel. An analogy that I use with my students is if you take a piece of partially thawed meat, you can press into that meat to a certain point before you feel the frozen part. And that's often what a fascial restriction in the abdomen feels like. You move through the outer thawed layers of the meat until you hit that harder, denser area. And it could be a patch of tightness, it could be strands or strings. You never know what you're going to find, but you're looking for that core. And once you find that, it's very common where your patient will say to you, yeah, that's my pain right there. Very frequently, you'll reproduce their back pain, pelvic pain, sometimes sciatic, lower extremity pain, that sort of thing. In the Foundations and Myofascial Release seminars, what I really try to do is to connect therapists with what they're feeling through their hand with the pain or the sensation that the patient is feeding back to them. Because once you connect, once you find that spot, you've got the feel, and that's where you want to stay. Now, this particular technique I use for evaluation, but I also use it for treatment. In my treatment, I may spend 10, 15 minutes in this technique, simply waiting, allowing each layer, each barrier to release one by one. And as I do that, the feel is going to change under my hand, sometimes very subtly, sometimes some drastic changes. The feedback that I get from the patient may be, in the beginning they feel it in their low back. It may drift into other areas of their body, up to their shoulder, down to their leg. And I simply stay there and follow it layer by layer. With myofascial release, the question often is, well, how do you know when you're done with a technique? Well, I'm done with a technique when I feel that everything's softened under my hand. And it may simply be because I feel like I'm done. I'm a little fatigued. We're getting near the end of the session. It doesn't matter. There's no rules here, very few rules. Whatever I do should be very comfortable for the patient. Bob, is this acceptable to you?
Yes.
What do you feel?
A release of pressure on my spine.
Okay. So you started out, when we started, you had some pressure?
Yes.
Okay. And whenever I'm done with a technique, I want to gently and slowly release my pressure. And I would always get feedback from my patient, check the whole body for maybe areas of redness, which might indicate areas that I may want to come back and treat at a later date, and reevaluation. If you're interested in more information on the seminars that I give, which are Foundations in Myofascial Release seminars, please go to my website, which is www.foundationsinmfr.com. And I'd like to thank WaltFritz for having me here today.